You're listening to Health Professional Radio with Wayne Buckler. Today my guest is Paul Coffey. Paul is a director of Solmed Proprietary Limited, a Sydney-based firm. Paul, welcome to Health Professional Radio. Tell us a little bit about Solmed.
Thank you for the opportunity, Wayne. Solmed was registered back in 2008 following a long career in the medical device and clinical industry. And it was set up basically to provide hospital quality products that were very rare to be able to get for the public, but to be able to supply those hospital quality products, in other words, validated products, all TGA approved, direct to the consumer. And as it worked out, not only did it go out to the consumer, but as the business has built, it's been going into hospitals and remote healthcare establishments, first aid posts, mines, and that sort of thing.
Now, Paul, Solmed is a Sydney-based firm, but your footprint's much bigger than that. Who do you service geographically?
We service all the way up to Gove, for example, right up north in Arnhem Land, all the way down to the Upper Isle, right across to the mines across in Western Australia, Tom Price, all the way up there. So virtually anywhere in Australia. Anyone that's got access to the internet or can find us can generally source product from us.
Okay, so give us a sense of the range of product. What sorts of things are we talking about?
Okay, we're talking about basic consumables, for example, a first aid kit. And I might add, the first aid kits we carry are all work health and safety compliant. So basically, if anybody wanted a bandage, they could get a bandage off us or a Band-Aid. But we go into much more elaborate product range than that. We go all the way into a lot of intravenous, a lot of anesthesia, a lot of urology, for example, catheters, Foley catheters, Nelton intermittent catheters, fully enclosed catheters for the disabled, all those types of products. So we're not just a consumable product, we're a device company as well. Okay,
so this is the range of gear that you would find in a lot of hospitals. What's the difference? Why does Solmed exist?
All right. Well, first of all, most hospitals go through government contracts and can buy, obviously, ISO 13485 certified products, which they have to have, which are TGA registered, of course. Mm-hmm. But for the public to get access to a lot of these products, they cannot, because the hospitals obviously buy in bulk, in carton lots, not always, but most times. And for the companies that manufacture these products, they're not interested in the consumer. They might go through a wholesaler in the pharmacy, but then the pharmacy throws a lot of margin and markup on there, and there's a lot of fat in there, if I can use that expression, for the margins. But with us, because of our 35 years in the industry, working in the industry, most of these companies are well known to me, and they supply us their products. Obviously, we have to do a certain amount of turnover in some cases, but they supply us and we'll break boxes. So, in other words, those same products that go into hospitals can be sourced from us, and we have many occasions where people ring and say, I've just got out of hospital, this is the bandage I'm using, this is what's recommended, do you carry it? Yes, we do. This is a wound care dressing I have, do you carry it? Yes, we do. But I don't need to buy, can I just get them ones and twos or half a dozen? And that's where we succeed.
And whilst pharmacies do carry or do sell a range of products, they generally don't have a lot of stock. If you're dialyzing at home or something and you need a few litres of saline, that's not going to be on the shelf at your local pharmacy.
Absolutely right, and that's where we come into play. And when people learn about us and find out where we are, and they're just so happy that they can come and get these types of products. Not only the saline if they're dialysing, for example, but they might want a cannula, they might want the IV set that goes with it, and so we have all that as well. And we have the expertise to talk about it.
Now, Paul, you talk about breaking cartons, and I guess that means you don't have to buy a carton of something if you only want a few of them. Wouldn't hospitals and nursing homes just consume cartons anyway?
No, not necessarily. Good example was only last week where we had Nepean Hospital called us. They wanted some specific ENT instruments. They didn't want to use 50 that come in a carton. They just wanted 5, but they want to buy 5 perhaps every few months, but they don't want the expiry to go out. So that's the example I can give you of just a recent one. So
yes, and expiry, it never even occurred to me. A lot of these products have expiry because of their sterilisation, I suppose.
They all do, and that's the key. People say, well, I want to buy a box because I'm going to end up chucking half of them out. So that's the advantage as well.
So, Paul, a lot of our audience are clinicians. What's the takeaway message that you'd like them to have?
Well, with clinicians, first I'd like them to get to know us, and this is one of the advantages of talking to you today, that they just need to go online, solmed.com.au, and then they will see the range we have, and it's virtually a one-stop shop. The only thing at this stage, we can't supply pharmaceuticals, but every consumable medical device and consumable we can supply. And pharmaceuticals is down the track because we're currently in discussions with some major pharmaceutical people to get our license. So that's an example as well. But more the hospitals and clinicians are going to say, well, I want this. I have a patient with this issue. Wound care could be a good example. What can I expect from Solmed? Well, first of all, we only carry products for wound care that have clinically published studies already published, and we can back it up with the science and the research.
Paul, in every business there's misconceptions, and it's my favourite question. What are the misconceptions about your business that drive you nuts and keep you awake at night?
It's interesting you ask that, Wayne. The biggest thing that keeps me awake at night is the cowboys I see that are online selling similar type products with no clinical knowledge, without any experience whatsoever, and the danger of giving bad advice. That's one aspect that keeps you awake at night. The second aspect that keeps you awake at night is a lot of the influx of product coming in from China, India, Pakistan, and those types of products that haven't even gone through TGA audit or TGA registration, and as such, the customers really are taking, in some instances, a big risk buying those products just to get it a bit cheaper. And I think the biggest headache for me is that every product we have to register. It costs money, depending on whether it's a Class 1, Class 2, whether it's sterile or non-sterile, but all of them cost money. Even the basic Band-Aid we carry has a TGA-listed registration. So we're just not prepared to take risks, but a lot of customers out there go and buy from these companies online that don't have any of those precautions in place. So that keeps me awake at night, sometimes.
Now, that therapeutic goods registration process, how does that benefit the consumer? What's in it for them by dealing with someone who's got TGA? Okay,
first of all, if a product has TGA listed, that means that the TGA has accepted that the international standard certification for that being a medical device is current and validated. For example, a manufacturer from China or India, there's lots of them, unless they have an internationally recognised certification of 13485, and the latest one's 2013, then they cannot, or they're not supposed to, export those products to countries such as us or America. We have the TGA, America has the FDA. Mm-hmm. And that's the advantage a customer has, that if you've got that TGA listing, all the manufacturing processes and all the claims made for that product to perform have been audited by an independent advisory body, and that's the important aspect.
And I guess clinicians would know this, but for anyone who's not a clinician listening, if you're going to rely on a product for your health and well-being, I guess you need the certification.
Absolutely. Well, I'll give you an example of just a basic fingertip pulse oximeter. You can go online and buy them from China, and very inexpensive. However, we have already come across certain pulse oximeters that don't comply with the international standards. So those companies haven't been audited, they haven't been tested. If they're not a plus or minus 0.1% of degree of accuracy, well then they don't comply. But many of them we've seen online and have tested are nowhere near the accuracy they're supposed to be. So that's why another reason anyone with TGA listed products, the consumer should have the confidence. The hospitals, by the way, Wayne, actually insist on TGA compliance, and that's why when we say we supply hospital-approved and contracted products, that's what we mean by that.
Paul, I can understand why that would keep you awake at night. That's certainly a big issue. Can I say thank you for your time this morning? Your passion's obvious when I talk to you about this field, and it's nice to know that someone's out there looking to make this more accessible for those hospital-at-home patients and others who need the service. You mentioned your website earlier, but I'll mention it again because every time I do this, I get complaints when I don't let people pick up their pencil first. So due warning, people, pick up your pencils. www.solmed.com.au. And the phone number for you, Paul?
Yes, it's 02. We're in Penrith on the western parts of Sydney, so it's 0247 210 371.
So that was 02 for Sydney, 4721 0371. My name's Wayne Buckler. You've been listening to Health Professional Radio. My guest this morning has been Paul Coffey of Solmed Proprietary Limited. If you've just joined us, well, you've just missed the interview. But the good news is we have a transcript on our website and a SoundCloud archive, and it's on YouTube as well at www.hpr.fm. This is Health Professional Radio. My name's Wayne Buckler.